Hi, Ultimate Wellness Tribe. Today I'm joined by the incredible Cynthia Thurlow. Cynthia is a nurse practitioner, host of the Everyday Wellness podcast, author, and international speaker. She is globally recognized expert in perimenopause, menopause, and intermittent fasting. She is on a mission to empower women to live their most optimal lives through perimenopause and beyond. She has been featured at major TV networks and delivered a TEDx talk that has reached millions. We are honored to have Cynthia Thurlow as a keynote speaker at our annual Ultimate Wellness Conference at Faena Forum in Miami Beach on September 26th through 28th. And at our conference, Cynthia will deliver her empowering keynote, Menopause, Hormones, and the Microbiome, Women's Health. So please join us, meet Cynthia in person, and be empowered and inspired by her and over 30 experts on health optimization and longevity. Now you can purchase your ticket with the promo code Cynthia at the ultimatewellness.miami/forum. Hi, Cynthia. Thank you for joining the conference. Thank you for supporting us. And thank you for joining me today. I have prepared a few questions to you.
Well, wonderful. It's so nice to connect with you and really looking forward to speaking in September with so many of my friends and colleagues as well.
Exactly. This year we have really strong and impressive lineup of speakers, and many of them women who empowers us to live through our menopause and beyond optimized and vibrant life. And we will have amazing panel discussion on women health and some well-known speakers such as J.J. Virgin, Dr. Amy B. Killen, Dr. Wanda Wright, and some other powerful women. Yeah, so definitely this is the conference to attend. Now, Cynthia, you have been in health and wellness space for over 25 years. What originally inspired you to pursue this path and how your focus evolved? Was it originally focused on women's health and intermittent fasting and intersection of hormones and microbiome, or it changed over time, and what inspired you to originally start and maybe shift your focus on women's health?
It's a great question. What I can tell you is that when I went to do my medical training, I thought initially I would focus in on women's health, maybe go into gynecology, but I trained in the inner city and I found so much of the patients that I interact with, I found it incredibly sad. There was a lot of socioeconomic issues at the time. It was the height of the AIDS crisis. The city that I trained in, it was, they had the number one IV drug use in the United States. They had the most HIV and AIDS cases. They had the highest rates of teen pregnancy, amongst a myriad of other issues. And so I kind of gravitated towards really ER medicine. And so initially I was worked in emergency medicine, and I'm a bit of an adrenaline junkie. And so it became very clear to me that I gravitated towards more acutely sick patients. I then, as a nurse practitioner, kind of dovetailed into cardiology and did that for 16 years. But I would say probably the last 5 years that I was in cardiology, I became much more interested in women in perimenopause and menopause because I was starting to see the same symptoms, the same complaints, even in cardiology, things that women were sharing with me that I was like, what is going on? I think we're so ill prepared, not only as clinicians, but also as women, to really understand what's happening in our late 30s into early 40s, the sleep issues, the anxiety, the depression. And so 9 years ago, I left traditional allopathic medicine to kind of create my own practice. And really for the last 9 years have laser focused on women in perimenopause and menopause. And actually, my first TEDx talk was on perimenopause, which at the time there wasn't a lot of focus on that transitional period. And so I would say over the last 10 to 15 years, intermittent fasting has been part of many strategies that I discuss with patients, but that's actually probably what I'm best known for. But it's a strategy that works for a lot of people, maybe not everyone. And then the gut microbiome has been something I focused on over the last 9 years, again, because I kept seeing trends with my middle-aged patients, looking at stool samples and food sensitivities, that it became apparent to me that something was changing with with our immune health, along with those sex hormones. And so I always say, life imitates art, and it allows me to be a little kinder to myself and allow women to understand that there's a lot of different ways to navigate this transitional period. But no, unfortunately, I did not start per se in women's health, but that was the intent until I got to the inner city. And then I think probably because I'm an incredibly empathetic person, it just became harder and harder to see women and pediatric patients suffering. So I kind of moved my way over to acute care medicine, where I felt like I could be more efficacious. But it's amazing how, life comes full circle. And this is really the work that I was meant to do.
Yeah, interesting, Cynthia. I didn't even know that your first TEDx talk was on perimenopause, menopause, because your second talk on intermittent fasting, more famous. It reached over 15 million views. And I didn't know that you was on forefront actually of this topic, perimenopause and menopause and women health. Interesting, really interesting. So as you're so experienced in this and you're on a mission to empower women, I know we have a short time, but let's discuss a little bit how can women navigate hormonal changes and manage those symptoms which you just mentioned. Sleep, all other hot flashes, and much more than that. A decrease in cognition probably sometimes also. And so how can we navigate these symptoms with more ease and more empowerment, and how actually those lifestyle factors such as stress, sleep, nutrition play a really important role in this women's health, and how we can not predict, it's inevitable process, and we will definitely have estrogen decline with menopause and perimenopause. However, how can we navigate?
Yeah, it's such an important question, because I would say to anyone that the most important things we can do while we're navigating that second third of our lifetime is really reflecting on lifestyle. So making sure you're getting high quality sleep, moving your body every day, whether it's strength training or high intensity interval training or just zone 2 training, making sure that you're consuming anti-inflammatory nutrition. I jokingly say we can't eat like we were 18 anymore. It's a time when inflammatory foods, whether it's gluten or grains or dairy or sugar or alcohol, you have to really look at your relationship with them and whether or not they no longer serve you.
Because of estrogen, because estrogen naturally it's anti-inflammatory.
A couple different things. I think that, what is really the precursor to the beginning of perimenopause is this loss of progesterone. So our ovaries are the pacemaker of aging in our bodies. And as our ovaries are producing less and less progesterone, because our ovaries are as old as we are. Unlike sperm that gets replenished every 72 hours, we are born with a finite amount of eggs. And so the hallmark of the beginning of perimenopause is less circulating progesterone. And I'm going to give you an oversimplification, but what that can lead to is some women may initially notice the week before their menstrual cycle, they have more anxiety, more depression, they may not sleep as well. They can also develop what I refer to as relative estrogen dominance, because during perimenopause, we have 20 to 30% higher levels of estrogen than we do at any other point in our lives. So you become estrogen dominant, which can lead to very heavy cycles, breast pain, bloating, weight loss resistance, which no one wants to deal with. And so helping women understand that estrogen plays a lot of different roles, but it's always this attuned balance with progesterone. So if a woman has polycystic ovarian syndrome, as an aside, they're already starting perimenopause with less progesterone. And so these may be women that get a magnification of symptoms as they're making this transition. So yes, estrogen does have some potent anti-inflammatory effects. The loss of estrogen also impacts immune function, which impacts our susceptibility to leaky gut. Leaky gut is important because if you open up those junctions in the small intestine, you can leak food particles into your bloodstream. And I would say most, if not all of us, have experienced even transient leaky gut. Sometimes you get it after eating a meal, after strenuous exercise, after a round of antibiotics. But women in middle age in particular, with that loss of estrogen signaling in the gut, are just much more likely to develop the sequelae. And the food sensitivity piece, Like, as an example, I am not able to consume dairy anymore. Dairy is really inflammatory in my body. Unfortunately, I used to enjoy occasionally having some ice cream or cheese, and that just no longer serves me. So for every woman going through this transitional period in their lives, it is as bio-individual as they are, which means what works for one woman may not work for another. But a lot of what we can do to temper the side effects or the symptoms we experience is with lifestyle. So again, the sleep, the anti-inflammatory nutrition, kind of reevaluating our relationship with alcohol. I used to enjoy having a martini once or twice a month. I can't do that anymore. It's the only thing that will give me hot flashes, and the hot flash piece is so unpleasant. I don't want to deal with that. But yes, lifestyle can be very important, as well as specific supplements, and then I would say hormone replacement therapy.
So basically, we need to look at this ratio between progesterone and estrogen. Is it correct, right?
Yes, I would say most women benefit in perimenopause with some progesterone. And the interesting thing is that traditional allopathic medicine, oftentimes what they offer women are oral contraceptives, which is not hormone replacement therapy, or they offer a progestin IUD, which is not a bioidentical option, or then surgical interop. So I always recommend that patients talk to their GYN, talk to their internist about the possibility of oral progesterone therapy as an option in lieu of those synthetic hormones, which can be very helpful. Let me be clear. If someone's already using an IUD or taking oral contraceptives, I think in perimenopause, if they need contraceptives, I think that's a very important discussion to have. With that being said, my best recommendation is usually just to start with progesterone, even if it's for a week or two out of your cycle.
But progesterone bioidentical.
Yes. So progestin is the synthetic option, and it is, people will say that something created in a lab is not identical to what our bodies make. Progesterone is the one that has all the benefits. Our hormone receptors know what to do with that. Progestin is very, very different, not just biochemically, but the way it interacts in our bodies.
Yeah, it's very logical that bioidentical hormones is always better than synthetic hormones, and yeah, really good suggestion. So what inspired you to create the midlife pause supplement line? How it's different from other supplements available for women on the market, and what are specific supplements are non-negotiable for midlife and menopause, perimenopause? And I guess those which are non-negotiable, they definitely present in your supplement line because it's created specifically for women. So most likely those supplements which you recommend, you definitely included in your supplement line. Tell us more. What is midlife pause supplements? What are the main components and some non-negotiable supplements which definitely you recommend to take?
Yeah, thank you so much. So the midlife pause was created because I was struggling to find supplements for my patients that met my strict kind of ramifications and specifications. So when I think about the supplements I like best for my middle-aged patients, it always starts with creatine monohydrate. And whether someone takes my product or someone else's, CreaPure is the cleanest form of creatine monohydrate. It's water wash, so highest quality that's available. Creatine is helpful for not just, people think about it as like bro science, but I remind people that it's very helpful, very beneficial for strength training. It is very beneficial, looking at early research, bone health, sleep, jet lag in particular. Like, I never have jet lag anymore, which is amazing, just by increasing my creatine. Vitamin D is very important with K2 because it's more bioabsorbable. Magnesium.
D3K2? D3K2?
Yes, D3K2. Yep. That is very important. Magnesium, which is coming as part of the line, and I'm very magnesium savvy after working in cardiology for 16 years. We have collagen, which I think is helpful for hair, skin, and nails. Most, if not all, women are feeling like their hair, skin, and nails start to change, especially with the loss of estrogen, which has a lot to do with elastin and collagen formation. Not to mention,
what is the best source of collagen? Which collagen do you offer in your supplement line?
So I have actually, it has marine, so it has marine as well as bovine. I've just come to find that when you look at it's more efficacious to include a couple different sources.
Mm-hmm.
There are two trademarked products that are collagen based, where there's been quite a bit of research, but they're extremely expensive. And so we source from the same places, but we don't have that little, trademarked form of collagen to use. But based on everything that I've looked at in terms of research, and my team and I are very research oriented, we felt like the combination of marine as well as bovine collagen is certainly beneficial. And then when we're looking at other things, anything that's going to help with upregulation of mitophagy. So urolithin A is a signaling molecule. That's not part of my supplement line, but I think that can be very helpful. I think about adaptogenic mushrooms, because so many women are less stress resilient as they're navigating perimenopause and menopause. And then the other thing that I see a lot of my patients struggle with is fiber intake. And we do know that fiber has tremendous benefits.
It's impossible to consume so much greens.
25
it's like impossible. It's just that's why I like to supplement this fiber as well. So
the fiber piece, because I find most of my patients really struggle to get 25 or 30 grams of fiber in, and certainly in the beginning, really challenging. So we have a fiber supplement. We have two other products that are coming this summer. One is inositol, which is actually a sugar isomer. But what's interesting is it's very beneficial for sleep. It has a lot of research on that, as well as blood sugar regulation. At higher dose, it's helpful for mood. I've had a couple experts on the podcast that have talked about how it can be beneficial for people with OCD and other mood disorders. That's not my area of expertise. I just mentioned that because it has a lot of applicable ways that it can be utilized. I usually say,
I like that you offer some alternative to melatonin for better sleep. For me personally, I like apple cherry because I never take melatonin. I don't believe it's good for us. I like to kind of decalcification of our pineal gland and some natural remedies. Maybe apple cherry, very good for good night's sleep, and all those adaptogenic mushrooms for managing stress. Also, what else? Ashwagandha, probably.
Love ashwagandha.
White American ginseng.
Yes. Well, and the thing that's interesting, and whether your listeners know this or not, ashwagandha is special as an adaptogenic herb because it's both tonifying and can be stimulating depending on what people need. So if someone needs it to be stimulatory, it actually can adapt to, hence the name adaptogenic herb, can actually adapt to what people need. And then I do have patients that take it in the evening. So I think that can be very beneficial, provided that they're not nightshade sensitive. So if someone is sensitive to tomatoes and peppers and eggplant and those kinds of things, ashwagandha, I typically will say is contraindicated, or at least you have to be conscientious about determining whether or not you're sensitive to it.
So your supplement line offer a pretty large range of supplements. It's a lot really important supplements, including even collagen, fiber, some stress management. Yeah, really, really interesting. Good. Sounds promising. Can we please discuss for a moment really quickly what is your IF45 coaching certification and who is this program for? Is this for everyone or those who already have some background in, like health coaches? What is this certification?
Yeah, so it's interesting. We have quite a few licensed healthcare providers, from registered dietitians, nurse practitioners, nurses, all the way to health coaches, nutritionists. So it's designed as a program in a box. So you yourself go through the certification, and then you have the ability to teach this course within your business. And so I've been incredibly humbled by how many amazing women are now able to teach the program within their practices or to their own clients, and to do it in a way where they feel really comfortable and confident with the science. So, 4 years ago when I was writing the book, I was also writing the coaching program. So it's been around that long. And to me, it's just very, very exciting to be able to help other female practitioners not only, bring another program into their business, but to feel, more confident and more comfortable discussing the science around intermittent fasting. And for some people, they like the deeper science. And then for some of the health coaches, or maybe people that aren't as comfortable with all the science, it allows you to teach it in a way that feels like it's in alignment with where you are in your business.
They can apply at any time, or it's some specific time when they can apply?
That's a great question. So right now, anyone we can, because everything is automated. It's a standalone course. So people go through the didactic instruction, and then there are quizzes with every module. And then after they have done all of the modules, then they take a test. And once they pass the test, then they have the ability to teach the program itself. So what we've gotten feedback on is that people like the ability to do the program on their own. So we give them 6 months from the time they purchased it to take the exam. And then it allows them to utilize the program within their business, which is exciting to me because I think, these are the kinds of things when I was a new entrepreneur that would have been really, really helpful to have, where someone's already written the course for you, you go through the training, and then you can implement it in your own business.
So it includes some pre-recorded sessions and then in-person meetings with you as well?
Yes. I don't meet with the graduates regularly, but there are monthly meetings. And what I encourage is, since there's so many amazing women in this group, that everyone take a turn to teach something to the group. And so sometimes, like, we have clinical psychologists in the group, we have registered dietitians, we have health coaches that are very niche down. Like, we have one woman who is an autoimmune expert, and so they meet once a month and they teach one another. And so
it's great practice also to be teacher as well, not only student but a teacher as well. It's a really smart decision to allow your students to teach. I like this approach. Really, really like this approach. It sounds very interesting. And where we can learn more about this program? What is the source or resource?
Yeah, easiest way is to go to my website. It's www.cynthiathurlow.com, where you can get access to everything that we've talked about. You can learn more about my business and who we serve. But yes, you can get all that information on the website.
Good. And how about one-on-one coaching? Are you seeing clients one-on-one? And if not, where they can start in your ecosystem? So if you see clients one-on-one, how they can reach out to you? If not, where they should start at your ecosystem? Probably from your podcast, Everyday Wellness, which is good podcast, and they can learn a lot from your podcast. But what else? Books. I know. At our conference talk, where else? Where to start?
I am no longer taking patients, but we do have programs, group programs, where people can interact with myself and my team. I'm very hands-on with our group programs. And a lot of the reason why I'm no longer working directly with patients has a great deal to do with just the way my business has evolved. But I do have team members, other advanced practice nurses, and health coaches that do work one-on-one with women. So some women will come through a group program with us and they want a little bit more fine-tuned experience. And so they can work with other advanced practice nurses or health coaches within my business, all of whom have been handpicked and hand selected. And most of my team has been with me for more than 5 years. So we've got a very, very incredible, amazing group of women who are solely focused on women in perimenopause and menopause. So really knowledgeable. I'm a big believer in that we're always learning and being a lifelong student. So I'm always encouraging my team to continue to evolve either their education or their learning experience. I'm in the midst of doing a functional medicine certification right now. My team keeps laughing and I'm like, I will be taking school or classes for the rest of my life. I love to learn.
Lifelong learner. And it's actually our conference also for such people who always like to be educated and be in forefront of all these innovations and learn all these new science-based approaches, which science changes all the time. Even coaches need coaches.
Yes,
this is why in your program coaches teach coaches. It's because when you are in your forest, you maybe miss new information. That's why we create this space for exchanging opinions and for education and sharing this knowledge between each other. And any final words of encouragement for women who is in their midlife and they feel like they're just getting started? What is the main suggestion? Where to start?
Yeah, I would say number one, I mean, I tend to be like a sponge. So whether it's a book or it is listening to a podcast, I would just get informed and educated about the way your body is changing at this time in your life. I remind women that we're not designed to just survive. We're designed to thrive in this stage of our lives. And so it's all about finding an empowering community of women to interact with. I think it's also really important to work with practitioners, whether it's an NP, a physician, a PA, working with providers that are knowledgeable about this stage of your life to help you navigate choices. And choices could be like the lifestyle piece that we talked about, or targeted supplements, or even medication like hormones. And the biggest thing that I would say that I wish I knew 10 years ago that I know now is that I should have started hormone replacement therapy a whole lot earlier. And I just didn't know any better. So I oftentimes will say to women, you will know when you are ready, because you will find that whether it's the sleep or the stress you can't manage anymore, or you become weight loss resistant, it's your body's way of just telling you that something is not properly balanced. And I can assure everyone that more often than not, when women are seen and heard and they are able to take action, amazing things happen. Our generation is not going to allow women to feel like they just, are just surviving for the rest of their lives. We really do want women to spend, that last third of their lives really thriving and vibrant and healthy, and not experiencing symptoms, if at all, and certainly having loving, healthy relationships with their loved ones, their family, their significant other, and being able to interact like this. Like I was telling someone the other day that when I think about like what my grandmothers went through when they were in menopause, I mean, I think about how unfortunate it is that they weren't able to embrace some of the things that we know about now that would have allowed them to not have all the health issues that they had throughout menopause, because it doesn't need to be that way. And I'm certainly grateful to have the opportunity to speak to this community.
Yeah, sounds like this hormone optimization is the tool to reclaim our power at midlife. And also, many coaches consider this as an elixir for longevity or cornerstone of longevity. And unfortunately, we don't have enough time now to discuss this hormone replacement or hormone optimization therapy, but we will have such a topic at our conference, and we will dive deep into this approach. And obviously, it has to be under supervision of really experienced doctor or nurse practitioner or health coach. And so it has to be done with personalized approach and data-driven approach. Before taking this decision, women, they have to consult, obviously, and learn if it's really good for them. But I personally also consider it for myself, and I also believe that this is really elixir for longevity and opportunity to reclaim our power. So thank you so much for joining us as a keynote speaker at the Ultimate Wellness Conference at Faena Forum in Miami Beach on September 26th through 28th. It's going to be a 3-day longevity conference where you can learn from the best experts in biohacking and longevity, explore cutting-edge biotech and health tech devices, eco-friendly products, and of course immerse yourself in transformative wellness experiences, including spiritual meditation, sound healing, breath work, all those practices that will help you to reconnect with your higher self and embark on this holistic journey, because I personally believe that we need to merge holistic approach to our health with the most advanced biohacking technologies, because those people who have these all pillars for longevity covered, such as sleep, nutrition, supplementation, exercising, then they will have better outcomes from these innovative technologies. There is no one pill which can fix everything, so let's do prevention and holistic approach to our health. Thank you so much. I look forward to learn from you and look forward to your keynote speech. And I am sure that your keynote speech will empower our guests and will inspire them to live this vibrant life and change their lifestyle, which is powerful. Intervention, just changing lifestyle is already very good. Then we can also do hormonal optimization and take advanced supplements as well.
Awesome.
Thank you so much.
Thank you so much. Thanks for your time.
So dear followers, please join us and purchase your ticket with the promo code Cynthia at the ultimatewellness.miami/forum. Welcome, welcome.